The floor is yours.
Thank you so much. Thanks a lot for the introduction. My name is Dr. Iman Zaki. I'm from Egypt. I'm a doctor, a physician, and I have, besides the MD, a Master's of Science in Public Health and Clinical Nutrition. And I've been working as a clinical nutritionist and a health consultant for the last decade. It's a lot of time, and I'm studying now for the microbiota pioneering in Malta University. And I'm just very, very happy to be in this workshop with you. I promise you, it's going to be very quick and it's going to be very interesting. I hope everyone enjoys, and please take notes and write your questions down so I can answer them by the end of this presentation. It's going to be so much fun. There's no need to stress out. And let's start with the title, which is Preventing Chronic Disease, the impact of healthy nutrition. How are we going to live a youthful and healthy life? Preventing chronic disease through healthy nutrition. So can we please share the slides? Here we go. And that's the title here. Perfect.
Yes.
And we start. In today's, can we please turn the slide? Thanks.
I think our technical crew is working on that.
Yeah, perfect. Preventing chronic disease and is the most important subject that we need to discuss in today's fast-paced world. Healthy eating habits play a crucial role in preventing chronic diseases. This presentation is going to explore the impact of healthy nutrition on overall health and well-being and provide practical tips on meal planning, maintaining healthy and nutritious diet. I need you all to be very alert for what's coming next. My aim in life is reaching and approaching to others by holistic nutrition, holistic approach to health through lifestyle changes. So I wish for you to learn from this presentation that we are going to focus mainly on chronic disease, such as metabolic disorders and diabetes, obesity, and how nutrition plays a very important and significant role in their progression and prevention. Also, I want to explore with you the role of low glycemic index foods in optimizing metabolic health. Providing practical tips for meal planning is so important, and we will organize together your daily routines for long-term health benefits. Moreover, I will look into the psychological advantages of a healthy lifestyle, including improved mood, reduced stress, increased mental clarity, and creativity. So, can we please move to the next slide? Next. So, what is the most health concern nowadays? What are the most chronic diseases that we are suffering from, caused by unhealthy eating habits and poor nutrition, of course? Chronic diseases such as obesity, diabetes, and metabolic disorders are growing to be a global health concern that requires nutritional intervention to control the body mass, to control the body fat, and control glucose levels. Mainly, metabolic disorders often linked to dietary choices and modern fast food culture. Consuming excessive processed foods high in sugar, saturated fats, coloring agents can significantly increase the risk of developing these chronic conditions that are growing to be concerning because they are now taking more lives than ever. So what is actually the metabolic syndrome? It's a group of metabolic abnormalities, increasing the risk of type 2 diabetes, heart disease, and other health issues. It's kind of a combination of abdominal obesity, elevated blood pressure, which is going to be more than 130 over 85 millimeter mercury, elevated fasting blood glucose, more than 100 milligram per deciliter, elevated triglycerides, more than 150 milligrams per deciliter, reduced the good cholesterol, which is high density lipoprotein cholesterol, less than 40 milligram per deciliter, and insulin resistance. And the diagnosis of metabolic syndrome requires meeting at least 3 criteria out of these 6 criteria. Here in this slide, we can see the pathophysiology, which involves insulin resistance, inflammation, and dysfunctional adipose tissue. Metabolic syndrome, mainly a mix or a combo between genetic variations, there's a genetic element into it, and environmental factors. Of course, we cannot control the genetic element or the genetic factor, but we can control the environmental factor, which is nutrition, stress, toxins, drugs, medication, and also lack of physical activity. This factor, which is the genetic factor, could be controlled if we control these other environmental factors contributing to the etiology of this disease. And the pathophysiology will lead to insulin resistance, which leads to dyslipidemia, hypertension, and prothrombotic states, which is going to cause blood clots, contributing to atherosclerosis and heart disease. So in order to avoid metabolic disorder or metabolic syndrome, which can cause cancer, diabetes, hypertension, lipodystrophy, we need to control the environmental factors. Next, please. Here, we are going to discuss how to control the nutritional element, which is the impact of unhealthy eating habits, the unhealthy dietary choices that we can cause, the ultra-processed foods, the sugar, the salt, the unhealthy fats. If we avoid all of this, we can control the nutritional element. These unhealthy dietary choices causes nutritional imbalance, and the cardiovascular disease that is the outcome of this nutritional imbalance is a byproduct of protein oxidation, lipid oxidation, advanced glycation end products, which stimulate the destruction of our entire metabolic system. In this slide here, the impact of unhealthy eating habits or ultra-processed foods. First of all, poor blood sugar control, which causes the insulin resistance and causes the chronic inflammation, weight gain and obesity. High caloric processed foods, high in added sugar causes weight gain and obesity. Cardiovascular health, as I mentioned, the trans fats, the saturated fats will raise the blood pressure and decrease the diameter of the arteries, which is causing the harmful cholesterol to turn into blood clots and promoting the development of plaques and leading to stroke and heart disease. Also, the nutritional deficiency, lacking of the vitamins, minerals, fibers, the impairing of optimal body function and increased susceptibility to infection. Moreover, mental health will be affected by highly processed foods because of the empty nutritional value. It's going to be associated with issues like anxiety, depression, and stress. And of course, if you're eating unhealthy, it's going to affect your digestive system. Your digestive system is going to be disrupted. The microbiota in your digestive system is going to be disrupted. The gut-brain axis is going to be disrupted, and you're going to have this disturbed metabolic markers. In this slide, I want to emphasize on all the well-documented studies that usually discuss the energy restriction, cutting calories, can improve weight. Yes, it could improve weight, improving insulin sensitivity, lowering the cardiovascular risk. But here I want to emphasize on the dietary effect, the whole food, the eating pattern, which have the influence on health outcomes. Consuming whole and processed foods rich in fibers, vitamins, antioxidants, and minerals will regulate the metabolic markers, will regulate insulin, will regulate the blood sugar, and specifically low glycemic index foods. Low glycemic index foods has the impact to be the #1 favorable factor in so many dietary regimens, like Mediterranean diet, the DASH diet, balanced meals. It is linked to lowering the risk of heart disease, metabolic disorder, diabetes, obesity, and cancer. Low glycemic index foods are the key for optimizing metabolic health, and we can here discuss the role of low glycemic index foods in optimizing metabolic health. Let's see or understand the glycemic index. Back in 1981, Dr. David Jenkins decided to create this ranking system that classifies carbs-containing food by their effect on blood sugar levels. The glycemic index measures how quickly a carbohydrate-containing food raises the blood sugar levels. So foods low in glycemic index, less than 55, are digested and absorbed very slowly, leading to gradual rise in blood sugar. The benefits of low glycemic index foods and consuming them: once you eat low glycemic index food less than 55, your blood sugar will be controlled and your insulin sensitivity will improve, reducing insulin resistance and reducing the inflammation and inflammatory markers, and thus reducing the production of new fat cells in the liver. So it's a sequence or a cascade of events. Here in this study, you can see the low glycemic index diet as an intervention in metabolic disease. In this systemic review and meta-analysis, they found that low glycemic index diets are effective in reducing body mass and body mass index, improving blood glucose, and metabolic disease. The analysis of 24 studies involving 2,000 participants revealed that the low glycemic index diet not only promoting satiety and weight management, it also lowered the fasting blood glucose and the hemoglobin A1C, or glycosylated hemoglobin, which is the average or the mean of your blood glucose in the last 3 months. And people have shown or observed better results for people who lasted in this intervention for more than 24 weeks. How can we incorporate low glycemic index foods in our diet? This is the main question. To include it, here you can see in this slide a list of food with their ranking number. So you can see, for example, the almond is 15, so it's safe, it's low glycemic index. The almond paste is 35. For example, the bananas are low to medium. And including low glycemic index foods in your diet, you can consume as much if it's lower than 55. And you can find the entire index for low glycemic index foods and medium and high glycemic index food in this link. And if you click on this link, you will go directly to the website, and they have the classification system and the entire index, providing a complete list of the low glycemic index that you should consume in good quantity, medium, and I advise my patients to consume medium glycemic index only during the day or before exercising, and high glycemic index foods that should be avoided. In this next slide, we can only assure you that incorporating low glycemic index foods in your diet with these 3 golden rules for healthy individuals would make each day meal planning nearly ideal. So the 3 golden rules for meal planning: #1, selecting low glycemic index food less than 55. Choosing anti-inflammatory foods. And #3 is calculating your protein intake according to your requirement, which is 1.2 up to 1.5 gram of protein for each kilogram of body weight per day for healthy individuals. And this range is going to be determined according to your activity level. Now we're going to explain each rule in details. The first rule is an effective meal planning is prioritizing low glycemic index food less than 55, balancing your macronutrients, considering the qualities and the portions of foods is crucial. And I have 2 notes here from my clinical practice. We found that combining 2 types of starch in the same meal will increase blood sugar levels more than separating starch, affecting insulin levels and weight gain. So for my patients who were wearing sensor for diabetes, we found out with observation, with practice, that mixing 2 types of starch, for example, potato and tortilla in the same meal, would increase their blood sugar more than separating starch. The second thing for eating low glycemic index food, you better eat in order. Vegetable first, then your protein, then the starch to be served last, which had better impact on blood sugar. Here, the second rule is meal planning strategies and including anti-inflammatory diets. This pyramid here, this food pyramid here is amazing, and it illustrates the anti-inflammatory meals and anti-inflammatory diet very well. Low glycemic index food with anti-inflammatory properties will double the benefit, in meal planning. So it will promote your metabolic health by focusing on whole processed foods, like anti-inflammatory foods. It's so unprocessed. And if you can see here, it starts with fruits, vegetables, then whole grains, nuts, fish and seeds, then all the natural fats like olive oil, rich in omega-3, then the different types of protein, finishing by the supplements and healthy desserts. The benefits of anti-inflammatory diets include reducing the inflammatory markers via the antioxidants and phytochemicals and important compounds that reduce the systemic inflammation in the body. Especially with obesity, you have a chronic inflammation. So eating more healthy anti-inflammatory options will increase the antioxidants and lower your inflammation. Lowering the chronic inflammation will improve your insulin sensitivity, will have better metabolism, and will cause increasing basal metabolic rate, which will make you fit and burn more fat, and the adipose tissue will be reduced. And anti-inflammatory diets particularly causes people to be full faster. It promotes satiety, which increases the chances to lose weight faster. The third and last rule from my 3 golden rules is the protein. So the protein intake plays a crucial role in managing metabolic syndrome, as they can help improve insulin sensitivity, improve weight, and the International Professional Organization recommended double the current recommended daily intake of protein for physically active individuals. So the current recommended daily intake of protein is only 0.8 gram per kg per day, but nowadays it's increased to the double, up to 1.5, up to 2 grams per kg per day for highly active individuals and professional athletes. In this chart here, you can see the protein contents of food. For each 100 grams of chicken, it yields around 28 grams of protein. For the seafood, for each 100 grams of seafood yields 22 grams of protein, legumes, grains, vegetables, and also it includes dairy products, which also include high amount of proteins. We can always balance our protein intake if we calculate our needs, our body requirement of the protein. Your body requirement will be 1.2 up to 1.5 gram per kg per day. The quality of protein is an important issue because you have animal-based protein and plant-based protein. The animal-based is high in essential amino acids with greater bioavailability and greater absorption. The plant-based protein lacks these amino acids and it's less bioavailable. However, it contains higher amount of fibers. So you need to mix both in order to have a balanced diet. In this slide, the next one, we have the an example of 1 week menu with many options of full meals with high protein, low glycemic index nutritionist option. You can mix and match and have an idea of how you can include very healthy options, high in protein, and different with a variety of nutrients, and choosing according to your preferences. Of course, if you have allergies, you're going to discard a lot of items here. But however, it's advisable to include fish 2 days at least weekly, and balance your meals with wide variety of protein sources and vegetables like animal protein, dairy products, and including plant proteins almost in every meal. You have here different amount of nutrients, different amounts of antioxidants, different amount of essential amino acids and non-essential amino acids. But in this schedule, it's just something I came up with because I needed to organize my week in order to have 2 days grilled fish, 2 days salmon or fatty fish, or like mackerel, 2 days cooked chicken, and just 1 day red meat to lower the chances of elevated cholesterol and saturated fatty acids. Here in the next slide, a very, very important note for holistic approach to daily meal planning. We cannot do without discussing the hydration plan, water and fluids. There is a calculation, and it requires us to calculate our water and fluids intake daily. 35 millis per kg per day of transparent fluids and water will ensure that you are well hydrated, that you are not suffering from dehydration. Divide this amount, the 35 millis multiplied by your weight, divide the amount 50% to be water and 50% to be transparent fluids, sugar-free, of course, for ensuring extra and intracellular hydration. And remember, this number, 35 milli per kg per day, is only the rule of thumb value. The actual amount depends on so many other factors like the age, the temperature, the climate, the physical activity, the metabolism rate. However, this is the rule of thumb value. And another factor in meal planning is always the supplements. We have 100 million supplements over the counter now, and it's always promoted that we need to take vitamins and probiotics and different supplements. But you cannot do this without discussing it with your healthcare provider to determine your specific needs and the suitable doses for you. Over-the-counter supplements like magnesium increases the metabolism and improves the digestion. Vitamin B complex for your nervous system. Probiotics for the good microbiota and healthy intestinal environment. Zinc and iron for your immune system and for your good hemoglobin. L-carnitine for good metabolism. All of these supplements will help you put your meal plan into a very, very good place, especially with vitamin D3 deficiency, which is an epidemic right now. You can discuss this with your healthcare provider. For the next slide, I'm just thinking out loud about the dietary approaches that are very common now, like the Mediterranean diet, the DASH diet, are effective in preventing and treating heart disease. Intermittent fasting, which is beneficial for cardiovascular disease and losing weight, where you can do only a certain window of time where you can eat during the day. The Nordic diet, that characterized by high fiber, high in legumes, high in fish, and very low in sodium and red meat. All of these dietary approaches, adopting balanced diet, whole foods, vegetables, lean protein, to prevent metabolic disease. And you can always add low glycemic index foods. Whatever the dietary pattern you're choosing, you should add low glycemic index foods. It's crucial not to only manage metabolic syndrome, but prevent its progress and complication. Now, the conclusion for this part of the presentation: the protective effect of healthy dietary pattern on metabolic syndrome are attributed to collective impact of small dietary changes. Rather than calorie restriction or restriction a single nutrient like in keto diets, we only need to do a small change and just swap high glycemic index foods with low glycemic index foods. The consistency and adherence to dietary interventions is the key to achieving amazing goals and the beneficial effects that will lead you to healthy metabolic markers. Now, I hope you're not bored yet. We will only discuss in brief the profound influence of healthy eating and lifestyle on mental health. Mental health is a really crucial topic nowadays. We're all, after COVID, suffering from anxiety, stress. So let's explore the impact of nutrition and physical activity on our mental health. And I want to provide valuable insights for individuals seeking to improve their overall well-being. Number one, for mental health, the influence of nutrition on mental health. For the next slide here, Lara Maria Lopez, with her friends, with her colleagues, in this review, examined the relationship between nutrition and mental health, finding a reliable connection between diet and mental well-being. For example, supplementation with vitamin D has been found to improve depression, mental health status. Supplementation with magnesium and vitamin B6 improved stress and anxiety and improved quality of sleep. On the other hand, the review emphasizes the role of real foods on mental health, not only supplements. And for probiotics, it has been proven to be effective with depression. However, it should not be seen as a substitute of conventional medicine, like proper medical care, pharmacological therapy, CBT. You need to add probiotics to the entire plan. And further research is needed to explore the relationship between the psychological impact of food, of real food, not only supplements. However, it's very well studied that Mediterranean diet has been associated with improved mental status and mental health. The second part here is the physical activity and mental well-being. In the reviewed studies, it was emphasized on the importance of combining physical activity with other interventions. Physical activity, whether at medium or low intensity, improves the overall health, also contribute to a better quality of life and mental well-being. Engaging in physical activity has been shown to be very effective for better quality of sleep and improved mental status by releasing endorphins and delivering more oxygen to your brain. 120 minutes of exercise weekly will be enough because you will have the maximum flexibility, health benefits, and you will avoid the injuries. You will feel good, look good, and it's crucial for your mental well-being. Another important factor for my holistic approach to health is the next slide, mindfulness and stress management. Practicing mindfulness, practicing yoga, stress managing techniques like meditation, deep breathing, and praying, probably. All this can reduce anxiety and cultivate the sense of calmness. For example, I use the app like Breathely. I left you the link in the references. It can be very helpful in regulating your deep breathing because it teaches you about different breathing patterns, and you can choose the breathing pattern daily for 4 minutes, which will improve the oxygen flow to your brain and optimize your organ functions. So it's very important as well to have mindfulness every day and like practice stress managing techniques for 5 minutes every day, because it's going to be crucial for mental health. The last thing here is the social connection and mental health. Building and maintaining social connections, playing a crucial role in promoting your mental health and well-being. Strong social support system will provide the sense of belonging and reduce feeling of isolation, contributing to better well-being and better weight, believe it or not. And this was proven in several studies. And recently, Netflix released this document, Live to 100, Secrets of the Blue Zone, where they discussed how these small sustainable changes individual can cultivate the resilience, the sense of resilience, the sense of well-being, improved mood, clarity, creativity, and overall well-being through not only nutrition, physical activity, mindfulness, but also building meaningful social connections. At the end, the take-home message in this last slide will be the aim of this session today. The last slide, please. Educating individuals on the importance of holistic approach to health and disease. Prevention by providing access to healthy option can foster positive dietary and lifestyle changes. Educating people about healthy options will improve their lifestyle. Making informed dietary choices and embracing balanced approach to nutrition and holistic approach to lifestyle will develop a better sense of well-being and will prevent debilitating conditions like metabolic disorders and cancer and heart disease and obesity. And it will also improve the mental well-being and our sense of wellness. Thank you so much. These are the references that I used. And thanks a lot and you can find all the links for everything I use here, whether the low glycemic index or the Breathly app. You will find it here with the references and the study materials and the studies I used. Thanks a lot. And if you have any questions, please go ahead. I would be very happy to answer them.
Thank you so much, Dr. Imran Zaki. That was a well-detailed presentation. And we're going to take the first 5 hands just to have, like, can you put up your digital hands, please, so we can be coordinated to have the questions. I saw Christine's hand first. Christine, the floor is yours. And if you have a question, please just put up your Zoom hand, your digital hand. Maybe Anita will come next after Christine. Christine, if you can hear me, the floor is yours for your question.
Hi, thank you so much. I'm from Cape Town, South Africa. Yeah, it's wonderful to be here with everyone. My question for you, I loved your presentation and just such a holistic overview of the importance of health. I'm actually doing my master's at the moment in brain health. And the question that I have for you is, I know Regan mentioned that we have more than 150 participants who registered for the workshop. And my focus is going to be looking at dietary behavior and how to encourage people to make the change. So my question for you is about how to ultimately get people to make those decisions in their daily life. Can you share maybe some tips or strategies that you share with your patients, how to encourage people to like stay accountable to, you know, the intention of coming to the webinar on a Saturday morning? How do people like, can you, like, how do you help people to actually enforce those changes? Thank you. Appreciate any insight that you might have for me.
Thank you for your question. It's very important, actually. It's a very important question. And I think I need to elaborate on improving overall health, not just stressing on the nutritional aspect. As you mentioned, mentioning the brain wellness, the mental health, the wellness of one's psychological status. This is the main factor that you should play on. Mood, playing on the mood, playing on the mindset to encourage people to come to a health workshop or to start a healthy dietary plan. You should encourage them to look forward for a healthy life and a quality of life that will improve their sleep, their productivity, their mental clarity, their mindfulness. So with this holistic approach where you can not only discuss the nutritional aspect, but the physical activity and the breathing pattern and the meditation and all these aspects together, all these elements together will give you the maximum effect and the maximum impact. So if you're addressing only the nutrition, you will miss out the fluids, you will miss out the supplements, which are very crucial to help people, to give them the first push, the first motivation. So you can just assess through the history, nutritional assessment, and overall assessment for the health and mental well-being, you can capture the point where you can, or the key where you can start with each individual differently. There is no one rule that will fit everyone. You have to assess everyone individually, and accordingly, you will start with this person, his key is going to be the fluids. This person, his key is going to be the physical activity. This one is going to be a motivational speech, giving or just referring to them to psychology or CBT. So you need to assess the patient or the client first, according to their mental well-being, their mental health, their history. When you assess the patient and decide exactly through observation, of course, very good observation, what exactly the main key that you're going to enter. It could be very simple thing, like just giving them vitamin D3 shot, so they're feeling better about themselves. If they are deficient in vitamin D3, for example, and they lack motivation and feel fatigue, you can give them vitamin D3, so they would feel better and start on a healthy pursue with you. I hope this is a comprehensive answer.
Can I just jump in and say that's actually a really good response, because I never thought that some people aren't interested in nutrition, you know, or improving their diet, but if they can see the other benefits to their sleep, to their quality of life, productivity, maybe that's really important to them. So that's some really good advice. Thank you.
Thank you so much. Thanks a lot. Thank you.
Okay, the next person whose hand will be taken is Patrick. I saw your hand next. Could you ask your question, please?
Sure.
Thank you very much. I don't know if I'm audible enough.
We can hear you. Please ride on.
Okay. Thank you very much. So first of all, I want to say thank you for that presentation. That was a very good one. Like I really was very insightful. And I also like the question that Christine asked, because it's a very important question to, you know, I feel like one of the things that people need to really pay attention to is, you know, discipline, especially with the fact that, you know, people are definitely aware of what is good for them, but the ability to, you know, take that decision to improve their eating lifestyle, you know, and all like that, it takes extra effort. So yeah, that's why it's important. I just have a very brief question, which concerns eating habits, actually. So what is the best time to have dinner? Because that's actually kind of controversial.
Yeah, I expected this question, of course. I was waiting for it.
What's the best time to have dinner? Because for me,
the best diet?
Okay, sometimes maybe because of work, you get back late, you're finding yourself eating dinner like maybe 9, 10 p.m. So, and
I will simplify this to you. I will simplify it to you. So
thank you very much.
The best diet out there, and it's proven to be the best diet out there, it is the Mediterranean diet. So if you can just Google Mediterranean diet and you can Google Mediterranean diet plans, you will have a general view of the best diet out there. Okay? When you Google the Mediterranean diet, apply the 3 rules that I discussed. Mediterranean diet is anti-inflammatory diet? Yes, it is. It's full of low glycemic index foods? Yes, it is. Is it rich in protein? Yes, it is. You only need to calculate your protein intake per day, which is going to be 1.5 gram per kg. And you're going to calculate your fluids and water intake, which is going to be 30 to 40 milli per kg per day. So just very simple steps. Google Mediterranean diet, download the template and highlight all the options that you like. After highlighting the options that you like, you're going to start calculating your protein intake, highlighting the low glycemic index foods, and emphasizing on anti-inflammatory foods like berries, fruits, vegetables, and fresh seafood and olive oil, for example. So just substitute your conventional fast food diet with Mediterranean diet. And it's going to be very simple to obtain a plan and just customize it on your needs.
Thank you, Doctor. I think, Patrick, that answers your question. You're going to Google about that. And
Okay.
so let's take
You buttressed on like the Mediterranean foods and how beneficial it is. But I don't know if my question was really answered. What I asked was for dinner, night time, dinner. That's last meal of the day, supposedly. What time is best? Is
Just before you go to sleep by 3 hours. Before you go to sleep by 3 hours.
All right.
You're going to sleep around 9, your dinner must be around 6. If you're going to
6
sleep,
p.m.
yes, if you're going to sleep around 10, so your dinner best be around 7 p.m. So it's at least 3 hours before you go to sleep.
All right. So I think another thing one needs to pay attention to is,
Patrick, your time is up, please. We have to talk. We have to let the others ask their question. You've just been talking on and on. Please, can we take Anita's hand? We'll come back to you when we have the question and answer session. Thank you for understanding. Anita's hand was up too. Sister Anita, if you have a question, and please, for the rest of us, let's keep our own questions to the question and answer session. We have to be time conscious. Anita, the floor is yours. Thank you.
Blessed morning to everyone. Are they getting me?
Thank you, Sister Anita. Thanks.
Yes, ma'am.
Yes, we can hear you now. Please write on. We can hear you, Anita. Please talk.
For the wonderful presentation. I am happy. My question goes, though I came late, but my difficulties has been like our brother has contributed. He asked for the time. What time is best for dinner? Because this is the difficulty I'm facing. Is there a repercussion? Like, is there a bad impact if you eat and sleep at the same time? Is there any effect?
Yes.
When you eat?
Sure. This is an important question. If you just eat and go straight to sleep, you will put yourself at a very bad risk of GERD or gastrointestinal reflux and esophageal reflux, where you have the acid of the digestion coming back from your stomach to your esophagus. And this might cause choking and during sleep, and it's very, very dangerous. And inhalation of this acid could be very fatal. So it's not advisable. It's not recommended. It's really bad to eat and go straight to sleep. You need to at least have a gap about at least 3 hours before you go to sleep. So your last meal should be at least 3 to 4 hours before your bedtime. Why? Because it might put you at risk of GERD, which is the gastroesophageal reflux disorder, and it's a very serious disease, and you don't want to put yourself there. Just make a huge gap between your bedtime and your last meal. And it's also advisable to enhance the digestion through going for a brief walk after your dinner so you digest better. Once you digest better and go to sleep, you will start having a better quality of sleep with deep breathing and deep sleeping, and you're going to wake up with a better mental activity and clarity and productivity.
Okay, thank you, ma'am.
Thank you.
Thank you.
My room is not coming out. I don't know what's happening.
Thank you so much, Dr. Iman. I first session of Christians. We'll take any other session. That was the first presentation. Thank you so much, Doctor. I think that was a good. My take-home message is that we have to be intentional and make deliberate dietary changes to have a healthy life. So we're going to take on a 5-minute break. We're going to take a 5-minute break. And when we come back, we'll be having a Kahoot game based on the first presentation. So if you took down notes, this 5 minutes is a time where you can have a look through, because there's going to be a surprise for whoever wins the Kahoot game. 5 minutes just for us to stretch, use the toilet if we have to, get a sip of water, and we'll be back. Thank you so much.
Thank you so much. Thanks. It was a pleasure. Thank you.
Thank you, Dr. Iman. It was nice having you. Thanks for the lovely presentation.
Yes.
Thanks a lot. I love it. Thank you.
So everyone, 5 minutes, and we'll be back in 5 minutes time.
Blessings.
No, as a link for.
Please let's mute ourselves. Please let's mute ourselves. Thank you.
Yes, kindly mute and we resume in 5 minutes.
You're muted.
Okay. Our break time is over. I hope we are all back from the break, and that was time enough for us to stretch. Now, we are getting into the Kahoot section, the game time of the workshop. And for this, we all should be participating. We're going to have the link in the chat box. You can connect directly from your Zoom meeting, or you can use your browser on the phone. That's if you're using your laptop and want to use your phone, or check the chat. And also the link was sent to you. You can use the link that was sent to you earlier. Please, let's all get ready. As we can see it displayed on our screen already. Okay, that's the game. The game pin is up. Please check the chat box for the link, and then put in the pin, put in your nickname. And once you join, we'll see you on the screen, and then we'll start once we have a good number of us on the game. So remember, there are 3 ways you could do this. First, please check the chat box to get the link and connect directly from Zoom. Secondly, if you have your phone and want to use your phone's browser, simply type in kahoot.it, and then that's it. You put in the pin and also your nickname. Or if you're connected from your phone, you can minimize Zoom and get to your browser, and that should work too. We are waiting for players. The game pin, if you can see, is displayed on the screen. 4755990. Okay, we have 1 player on already. Please, let's join. Just put in your nickname. It's easy. Type in the game pin and you'll be in. I can see 1 person is in already. Could the rest of us please join to save time? Thank you. Welcome to the second person. Andy's in. Technical crew, can we have a timer to make this swift in the next 1 minute, a 1 minute timer if that's possible, so that at the end of the timer would start with those who joined. I think joining on time should be one prerequisite. Okay, we have 4 participants. Please, let's join. Check your chat box to find the link. Use the link that was sent to you earlier, or simply from Google, use your browser, type in kahoot.it and put in the pin as well as your nickname. I see more people have joined. Thank you. Okay, 7 participants. How many of us are at this meeting? There's going to be a gift for the winner. Maybe that's insensitive enough for you to want to join. We are 20 on this meeting, and I'm having 7 people for the Kahoot game. Can we join? Can more people join? Can we join, please? Okay, maybe if we have 10 people, then we'll start. Technical crew, are you ready? Let's be getting ready to start. The winner will come from those who've joined. Everyone could join because we all follow the presentation, and all the questions will be based on Dr. Iman's presentation. So don't be scared. They are not questions from the sky. They are questions based on what we just discussed a while ago. 7 people. We have more? Are we having any technical issues joining? If you have a problem, please, do you have any difficulties in joining the game? Yes, please, let us know. If you read the message from the chat, let us know. So if you want to join and you're having an issue, could you please indicate in the chat there's somebody there to help you out? We have one of us in the chat willing to help out anyone who has a technical issue. If you can't see the pin, I'm going to read it out again. 4547, I beg your pardon, 55990. We have 7 people still. Could we have 3 more? So we have 10 out of the 20 participants. I would have loved to join, but being the anchor, I'm disqualified from joining. Well, okay. Okay. Two more people, thank you. You can zoom and track. It should. Just 2 people left again.
I guess it's their connection.
I hope you're not having technical issues with the camera. And Bethany's iPhone said she's using her phone and your browser and it should work. Could you try that? Okay, technical crew, once we are ready. Okay, 8 participants. Please, what's your concern, Hassan Jampol? I see you say you have a technical issue. Could you be precise? What's the issue? So that one of our technical crew members can help you. Is it a network or you're having difficulty?
Yes,
connecting?
I'm not succeeding to be among the members, as you have said. I don't know the procedure.
Okay, we have a message from the Encourager Association that is saying open your browser and setting.
I beg your pardon?
Okay,
hello, please, you can try to open from your browser and you type kawood.it on your browser, because on mobile device, the app cannot work from within Zoom. So you can open your browser and type kawood.it, then you enter the game pin on the screen.
Okay, I will try because I'm using your phone.
Okay.
Bye.
Okay, shall we start? I think we can start now with those who are on the game. Let's start, please. Which chronic diseases are specifically mentioned in the presentation? That's the question. Metabolic diseases, diabetes, obesity, all of the above. Just click on the right one on your phone. And the time is ticking. The right answer is all of the above. And we're going to see our winner's chart. Okay. Next question, please. That's a scoreboard. What is the focus of the presentation regarding the role of low glycemic index food? Improving physical appearance, enhancing mental clarity, optimizing metabolic health, preventing infectious diseases. Pick the right answer and we'll see our scoreboard. Time up. Optimizing metabolic. Good, there we go. Okay. 3 out of the 15. Number 3. What are some psychological advantages mentioned in the presentation related to a healthy lifestyle? Increased risks of chronic diseases, reduces stress, improved mood, all of the above. The time is ticking. What are some of the psychological advantages mentioned in the presentation related to a healthy lifestyle? Increased risks of chronic diseases, reduced stress, improved mood, or all of the above. Technical crew, could we have some more sound on a Kahoot game, please? But let it not drown my voice, though. Thank you. Thank you. Okay, the answer is improved mood. Wow. Question number 4. How can individuals significantly reduce their risk of developing debilitating conditions according to the presentation? By following fat diets, by avoiding all carbohydrates, by embracing a balanced approach to nutrition, by skipping meals. Which of the above? By following fat diet, by avoiding all carbohydrates, by embracing a balanced approach to nutrition, by skipping meals. Technical crew, how long should the timer be? Because I have the impression that it's longer for some questions than others. Okay, there we go. Chatu, somebody is leading. What is a key takeaway message regarding the impact of nutrition on chronic diseases and overall well-being? Nutrition has no significant impact on chronic disease, making informed dietary choices. Chronic diseases are solely genetic and cannot be influenced by nutrition. Nutrition plays a minor role in overall health and well-being. Those are the options. Kindly pick the right answer. Time up. Which of the following is a major risk factor for chronic diseases such as heart diseases and diabetes? Such as heart disease and diabetes, high fiber intake, excessive alcohol consumption, regular physical activity, adequate hydration. Which of the following is a major risk factor for chronic diseases such as heart disease and diabetes? And there we have our answer. Question 7 out of 15. What type of fat should be limited to reduce the risk of a heart disease? Unsaturated fats, omega-3 fatty acids, and polyunsaturated fats. Which type of fat should be limited to reduce the risk of heart disease? Please, for those of us who didn't join the game, we should follow this session because we can be learning from the right answers too. Thank you. Saturated fat. Mating is still leading. Which of the following is an example of nutrient-dense food that can help prevent chronic disease? White bread, candy bars, leafy green vegetables, sugary soft drinks. Which of the following is an example of a nutrient-dense food that can help prevent chronic diseases? Leafy green vegetables. The winner is there, topping the chart. That's a scoreboard. Now, question 9. A diet high in which of the following is associated with the lower risks of chronic diseases? Processed food, fruits and vegetables, red meat, sugary snacks. A diet high in which of the following is associated with lower risks of chronic diseases? The diet high in processed food, red meat, fruit and vegetables, or sugary snacks? Let's find out. Fruit and vegetables. Okay. Question number 10. Which of the following dietary habits can help maintain a healthy weight and reduce the risk of chronic diseases? Keeping balance, eating only carbohydrate-rich foods. Which of the following habits can help maintain healthy weight and reduce the risks of chronic diseases at the same time? Time up. The answer is consuming balanced meals. Okay, that's a scoreboard. And question 11, which nutrient is important for bone health and can help prevent osteoporosis? Which nutrient is important for bone health? Vitamin C, vitamin D, iron, or sodium? Which of those nutrients? Vitamin C, vitamin D, iron, or sodium? Time up. Question 12. Regular consumption of which of the following is linked to a decreased risk of a certain type of cancer? Let's have the answers. Red meat, processed food, whole grains, or sugary drinks. Regular consumption of which of the following is linked to a decreased risk of a certain type of cancer? Time up. Whole grains. Wow. Question 13. Which is a recommended strategy for reducing sodium intake to lower the risk of hypertension? Using more canned vegetables, cooking at home with fresh ingredients, eating out frequently, adding extra salt to meals. Which is recommended to reduce sodium intake to lower the risk of hypertension? Cooking at home with fresh ingredients. Meeting is still leading us scoreboard. Question 14. Which of the following is true about trans fats? They are beneficial for heart health. They are found in the fruits and vegetables. They should be completely avoided. They are recommended for weight loss. Which is true about trans fats? Time up. Okay, the last for this session. How does Regular physical activity contributes to the prevention of chronic diseases, increases the risk of obesity. It leads to sedentary lifestyle. It helps maintain healthy body weight and improve cardiovascular health. It decreases muscle mass and strength. What does physical activities help for? And that was the last question. Let's see. In third position, J. In second, and the winner is Spotlight. Congratulations, the winner of our Kahoot game.
Please, could we know who is mating? Because we have a gift for you. You could just drop your maybe email address on the chat, and we could reach out to you after the workshop to forward your gift to you. Could you please reveal yourself, the winner? Thank you.
So did the winner get that? Okay, he says thanks. I don't know if it's he or she. So I am guessing they got what you were saying. Thank you everyone for participating. Congratulations to the winners and to the top winner. And that was also an enriching session, because from the answers we could learn one or two things about health and nutrition. Now we're going to get into the second presentation, and it's going to be, the title is Lifestyle Factors That Can Influence Our Immune System. Lifestyle factors that can influence our immune system. And this presentation is going to be done to us by Dr. Chantanya Mantri. Let's welcome Dr. Mantri. The floor is yours if you're here with us, Doctor. You'll tell us more about
Hello, everyone.
health.
Hello, everyone.
Hello.
Hello. Am I audible?
Doctor.
Hello.
Yes, we can hear you.
Yeah, if we could have some more volume.
So you can start the presentation. You can share the presentation from your end.
Yeah, sure.
Okay. So today we are going to discuss on an important topic called lifestyle factors which are affecting the immune system by an occupational therapy perspective. I myself am an occupational therapist. My name is Dr. Chaitanya Mantri. I am practicing as a consultant occupational therapist in Mumbai, India, since 2007, and treating lots of patients in orthopedic, neurological, mental health conditions in clinical hospital setup or home visits, and nowadays through online consultation as well. I am being associated with Live Love Laugh Foundation, which is being managed by Bollywood actress Deepika Padukone, which works with patients with major depression, schizophrenia, and suicidal tendencies as well. I'm conducting lots of workshops in different languages like Marathi, Hindi, and English in different areas, whether it is the rural or urban areas, in different setups in school, in community-based, and as well as in corporates as further. So we'll move to the main presentation. Now, the purpose of this presentation is to describe the relationship between lifestyle factors and immune system. We are very much aware about the term lifestyle. So the lifestyle term includes the way we eat, the way we sleep, the way we exercise, the way we move, the way we behave, the way we get engaged with others, including socialization. And at times, it is also related to drug abuses or substance abuses as well. So we are going to discuss this presentation with this perspective as an occupational therapist. So what is basically occupational therapy? Occupational therapy is a branch of rehabilitation which works in physical and mental health. Like a physiotherapist works in a physical condition, occupational therapist works with orthopedic, neurological, psychiatry, psychological condition, as well as plastic surgeons if required. So we see the patient with physical and mental condition per se. So what is the definition of the immune system? There are two types of immunity, that is innate immunity and adaptive immunity. The body's first line of defense consists of barriers like skin, mucous membrane, and cells like neutrophils and macrophages, which protect us from any kind of infection. Another form of immunity is adaptive immunity, which involves T cells and B cells, which can specifically target the pathogens and create memory for further immunity. This was seen during the COVID-19 times when the world was going through pandemic, and we were searching for different kind of antibodies to fight it in the future. Those who already had a history of COVID, these people had those memory of immunity with them. So in this case, T cells and B cells play a major role. Next slide. Now, as we have seen in the previous presentation about diet and nutrition, it plays a major role. A balanced diet is very much essential for a healthy immune system. This should include essential nutrients like vitamin A, C, D, E, minerals like zinc, iron, and it is very much essential to have omega-3 fatty acids in the diet. Impact of nutrition has a major role on our immune system. Reduced nutrient in the diet will affect immune system. So the less the nutrients, the immune system will suffer more, and we will be having a risk of early infections. Move to the next slide. So what is occupational therapy approach to all this treatment? Occupational therapy works through assessment, intervention, education, and environmental modification. What is assessment? As the previous presentation has mentioned about dietary pattern, different kind of diets and nutrition. Similarly, we have to working here on dietary habits, nutritional needs of a person, and cultural factors. Different cultures have different way of having different nutrients in different timings of a year. So we will focus on dietary habits, the nutritional needs of a particular person, whether the person is having a sedentary lifestyle or a person is having a more heavy task in his day-to-day activities, and it should include the cultural factors. After assessment, detailed assessment of the client, we will go to the intervention part, which will be in collaboration with the dietitian and the nutritionist. Here, we create a personalized meal plans along with the dietitians, and we suggest them a healthy eating patterns. Now, in my country, India, we basically follow 3 patterns of meal. That is a breakfast, then there's a lunch, and then dinner. But we also have a timings for all this. Say, for example, the breakfast should be heavy, and it should be like a king's meal. And it should be between 7:30 to 8:30 a.m. in the morning when the gastric juices are very active. The next meal will be the lunch, which will be around 12:30 to 1:30 p.m. in the afternoon. And it should be less in quantity. And the last part of the meal will be in the evening, that is 6:30 to 8:30, around 3 hours before going to bed, at least. And this should be the lightest meal. We regard this as the breakfast should be like a king, the lunch should be like a common man, and the dinner should be like a poor fellow. So our diet should be lesser in the dinner and more in the breakfast. So this kind of a dietary pattern, considering patients' other factors like the diagnosis, any previous history of any other condition, that has to be tailor-made to the patients. The next part should be education. We have to teach the client about the balanced diet, provide mealing planning resources through different leaflets, through different websites, through apps, or any other sources, like say, for example, lectures which we have conducted today. We should encourage whole foods and vegetables. We should encourage the importance of vegetables in our diet, the use of fibers in the diet, and we should help to advocate it within the community. And the last part would be environmental modification, which will promote regular meal scheduling, considering their work patterns, reduce access to the junk foods as it contains lots of salts and which can add to added difficulties, say for example, hypertension, or those with a risk of cardiac conditions. These things can give a negative effect. Along with that, we have to create a supportive kitchen environment. Our kitchen environment should be such that it should help in creating an environment for a proper nutrition. Next slide. Now, the second most important part is the physical exercise and activity. Now, consider a person who is having a sedentary lifestyle, like those working in IT sector, or those who are having an office job. In though these people, their more activity is in a sitting position. So we should encourage them for a walk. We should encourage them for a resistive activity. We should encourage them for aerobic activities. Okay, this will help in preventing obesity-related difficulties. So what we can do, we can tell them to take a brisk walk after 40. Yes. So we can tell them to go for a brisk walk after 45 minutes of their activity. We can keep some kind of a modification in offices whereby there are cycles. There is steps available for stepping exercise, or some kind of a therabands or weighted cuffs, which can help in providing them with the resistive exercise. So this will help in strengthening their stability, improve their posture, and overall help in reducing the obesity. The next slide. Now, what will the occupational therapy approach work on? Occupational therapy approach will be, in this case, again through assessment, intervention, education, and environmental modification. What is assessment? We have to evaluate the client's current level of activity and identify the barriers to the exercises. Say, for example, if a person is doing heavy work, we would encourage him some kind of relaxation activities. Okay, like we can ask him to go for a yoga session. If a person is doing a sedentary work style, we can encourage him for a walking pattern, or cycling can be encouraged. Different intervention like developing a personalized exercise routine, which are tailored to the patient's needs and wants, and according to the person's age, is essential. And third part would be education. We have to teach the client about importance of regular exercise for better immune health, which will provide him information of safe exercise practices and again injury prevention. This would involve work simplification and energy conservative techniques. And the last part will be environmental modification. We have to recommend adjustment to client's environment to promote physical activity, example, standing desk, home exercise equipments, and other devices. Next slide. The third important part in the lifestyle is sleep and rest. A sound sleep will give you a good immunity. So we should have a good amount of 7 to 8 hours of a nice rest or sleep just after we complete our work. This can include added small naps in the afternoon after you have a meal. In India, we call it Vama Kukshi. Vama is left, so rest on your left side of the body for at least 15 minutes after you have your lunch. So this helps in better digestion, relaxation of body. So altogether, we can have a 7 to 8 hours of a sound sleep in a day, which would include a 15 minutes of a small nap in the afternoon. Sleep deprivation reduces the production of cytokines and affects the T cell functions of the immune system, increasing the person to vulnerability to infection. The impact of sleep disorder on immune health would be more if a person will have history of sleep apnea and insomnia. So we'll move to the next slide. So what is occupational therapist approach? Occupational therapists work through, again, assessment, intervention, education, and collaborative care. So in assessment, we need to assess the sleeping pattern of a person. Now there are different kind of devices available with us, whereby we can come to know exactly whether the person is having a sound sleep or not. We can connect these devices to our mobile phones, and we can come to know the exact sleeping pattern of it. So this kind of a objective assessment will definitely help us to know the pattern of the sleep, and we can make some changes with it. So we can also assess whether there's a loud noise where he is sleeping. The texture of his mattress can affect the sleep. The stressors or psychological stresses through which the person is going can affect the sleep. And at times, the light arrangement within the home environment can affect the sleep. So this kind of assessment has to be there. Then we will go to the intervention part. We have to develop a strategies to improve a good sleep hygiene. This would include consistent sleep schedules, relaxing bedtime routines, and sleep-friendly environments. Now, what we can do for a sleep-friendly environment, we can keep a light music, which would help in relaxation of the sleep. There are different kind of apps which help us to understand the sleep pattern of a person, and accordingly we can change our pattern. We can tell the person to go to our sleep early in the early at night, so this can initiate it better. There are the different kinds of medications available which will help in initiating the sleep easily. So we can take help of these kind of things for better sleep pattern. We can educate the person that we should switch off all our mobile phones, all the televisions, all the screens, at least 1 hour prior to going to the sleep. This will help in initiating the sleep easily and reduce the stress on our eyes. Okay, we should avoid use of mobile phones or laptops on our bed. The more we follow these kind of a sleep hygiene, the better would be the sleep and better would be the quality of living. We should educate the client about the importance of sleep for immune health. The better the sleep, the good you have immune health. So we have to focus on encouraging people for early bed and early to get up in the morning. So this kind of a healthy pattern will maintain our immunity. We should collaborate with other kind of sleep specialists, like those psychiatrists working in this condition, or healthcare professions working in sleep related disturbances. The next slide. Now the fourth important part of lifestyle is the stress and mental health. Stress has a bigger role in all the aspects of our life. It might be a work stress, a relationship related stress. It can be stress with our neighbors. It can be stress with our children's, their way of behavior. It can be stress related to anything. It can be related to our financial conditions. We had suffered a huge stress during the COVID-19 times, when it was not just a physical stress, it was health related stress, it was financial stress, and in overall, it was affecting us every day. So chronic stress will lead to increased cortisol levels, which we will call bad hormones of the body, and which can suppress our immune function and increase inflammation. We will not feel easy. We will have joint pains. We will find it difficult to think at times, and this will affect our overall confidence and quality of living. Stress is again associated with higher risk of immune-related disorders such as autoimmune disease and chronic infections or recurrent infections. Next slide. Occupational therapy approach in this condition is again through assessment of the cause of the stress, whether it is within the family responsibilities, whether it is at work-related responsibilities, or whether it is because of some other health concerns. The more the stress a person has, whether it is a physical or mental stress, it directly affects the cells of the body. Our cells get stressed, and because of that, their functions get affected. So we have to assess where exactly the stresses are coming. Then we have to move to the intervention part, which will include stress management techniques, as mentioned before, such as mindfulness, deep breathing exercises, pranayama, yoga, and guided relaxation techniques. Breathing directly affects the way we think. So in yoga and breathing exercises, we focus more on the way of we breathe, how much air we take in, inhale while we breathe, and how we relax. There are different kind of relaxation techniques like the shavasana in yoga, which help a person to completely desensitize from the external world. Even in modern times, techniques like Reiki are being practiced, and this help in initiating relaxation of the body, reducing the stress, and improving the sleep pattern as well. Reiki is being practiced nowadays in different hospital setups, along with that clinical setup as well. The more details about Reiki, which is again a Japanese technique, is available through different resources. You can Google it out later, and you can learn it for the betterment of your health. Then the third part is education. We have to teach people one more important thing, that it is not we who can do everything. So we have to understand first our limitations. We have to understand our opportunities and the areas from where we basically can help these people. Say, for example, we can provide them with different resource materials. Like, say, for example, use of meditation apps are nowadays available. Support groups are there. We can make use of a social networking. It can be one-to-one person. It can be in a community. It can be a kind of a small activity which will involve, say, for example, trekking, hiking, whereby we meet together, we talk with each other, we do a particular task in a stipulated timing. So this can give a kind of reduction in stress as well as encouragement in our quality of living. Then occupational engagement, encourage participation in meaningful activities and hobbies, like, say, for example, going for a walk together, reducing stress, having a walking meetings. So instead of having a meeting in a sitting position for long hours, we can prevent these kind of physical problems for prolonged sittings, reduce those stressors. We can create a happy environment in offices, in school, in home environment, which will help reducing the stress. And the most important thing, we can laugh. Laughter helps in improving our immune system and reducing the stress. So nowadays, different kind of laughter clubs are there in different gardens or different communities, just to encourage reducing the stresses. We can have a common goal like reading a book, reading poems, reading or any kind of important information in front of a community. This will help in creating a bonding, which again reduces the stress and facilitate involvement in social and recreational activities like gardening, playing, or any kind of a competition would definitely help. So next slide. Social connections and relationships, and again social support, which will help in immune health. The more a lonely a person is, the more affected his immunity. That's why in many communities and different countries, it is said that if you are married, you are more happy. Or if you are in a relationship, or if you share your thoughts with any other person, or you have any kind of social support, your immune health would be better. So strong social connections are associated with improved immune health, and that would help in reduction of stress-related immune suppressions. Social isolation and loneliness will reduce your confidence and increase the stress and decrease your immune function. You will lose your confidence, your ability. I've seen many graduates and postgraduates. They are very good in their education, but when it comes to presentation, they lose their confidence. That's because at times they are disassociated, or they are disconnected from their social networks and connections. They have reduced their expression within the community, and that's where it affects and increase the anxiety. What is occupational therapy? Next slide. What is occupational therapy approach in getting this social connection back? First is assessment. We have to determine the client's level of social engagement, whether the client is comfortable through online sources, like say for social media, any kind of online lectures like we are conducting right now, or whether the person is comfortable enough in a community, in a one-to-one gatherings. So we have determined the client's level of social engagement and identify the barriers to social interaction. Like say, for example, whether the person has communication-led difficulty, any kind of anxiety, like social anxiety, difficulty in transportation if a person is having physical disability, or any other difficulties in the way of communication, whether it is in written or oral form. Then intervention will include encourage the participation in community activities like a group activity or Sunday activities or Saturday evening activities, or it can be a singing competition, or it can be a competition or a games which we play, just to have a kind of a socialization. So this kind of intervention techniques can be made use of. We can facilitate social connections by organizing different camps, providing resources in local newspapers or magazines or through blogs or apps. Use of education as a tool. We can teach clients about the benefits of social connection to help in improving the health. The same education has to be provided from the schools to a college or university level. And last would be environmental modification. We have to suggest changes to clients' environment to promote social engagement, like creating a welcoming space for visitors, setting up virtual communication tools or virtual communication boards, or any other method which will help in improving communication. Communication can be oral, communication can be written. There's some who are better in chatting on a mobile app, but they find it very difficult if they see the same person in front of them. So we have to change the pattern. We have to change the working environment to help in encouraging the social connections. Next slide. The fifth most important thing is the substance use and exposure to toxins. Smoking and alcohol consumption is injurious to health. Okay, so smoking increases the risk of respiratory infections. The person who smokes, he gets the infection. Along with that, the person who is normally we call the passive smokers, they also get affected because of that, and that affects their white blood cells. When your lungs are affected, less you breathe in, or less your alveoli will function, and that will reduce the overall oxygen carrying capacity of your cells. So that we have to reduce. I would not say it is not possible to completely disconnect from smoking. If it is, then it would be better. But smoking has to be reduced to help our breathing function and prevent respiratory infections. Then the second part is alcohol consumption. Excessive alcohol consumption has directly linked to the liver damage. So, and which will help in increasing susceptibility to infection. So we should have a check on this smoking and alcohol consumption. I myself, previous slide, please. I myself have conducted different de-addiction camps for alcohol de-addiction and tobacco de-addiction in different areas, whereby these different employees of a particular institution, we have a Mahananda Dairy in Mumbai, where there are 1,200 employees of different hierarchy, like they are workers and there are officers or administrative. All these people were affected because of substance use of alcohol and smoking, which affected their quality of work. And finally, it affected the profit of that institution. So they called me to conduct different kind of camps, to do one-to-one workshop or one-to-one sessions with these kind of clients, and to help them completely go away from this habit and to improve the quality of living. Because these people cannot be suddenly replaced with a new batch of employees. So we had to go for a different kind of a de-addiction work. I have done a lot of work in by written means, like through magazines, through articles, in this case of de-addiction. Next slide, please. So occupational therapy approach would involve assessment and identifying the pattern of substance use and exposure to these toxins, discuss the risk associated with smoking and alcohol consumption. Alcohol not only affects your liver, but it also affects your thinking pattern. At times, because of excessive alcohol consumption, it leads to change of behavioral patterns, that a person becomes more aggressive. At times, hitting and beating behavior increases, and it finally affects his social, personal life, family life, and social life. Intervention would involve provide support for smoking cessation and alcohol reduction, collaborate with addiction specialists. These are normally those who are psychiatrists who are working in alcohol de-addictions, and recommend resources for cessation of programs. Education, inform clients about the impact of substance use on immune health, offer alternatives for managing stress and anxiety without restoring to harmful substances. And last part is environmental modification. This would include suggest changes to the client's environment to reduce the exposure to toxins and discourage substance use. Example, smoke-free homes, avoiding environment where substance use is common, educating the family, educating the people in the workspace, educating the community, and help promoting the de-addiction and effects of smoking and alcohol consumption in theaters, through radios, through social media, and other means. Next part. Now, the conclusion, the main takeaways about lifestyle factors we are going to discuss. What is the role of occupational therapy in the entire process? And what is the occupational therapy action plan? We'll move to the next slide. So the main takeaway about lifestyle factors for immune health is, first thing, nutrition has a major role. Physical activity is necessary. Sleep and rest is essential. We have to reduce the stress for better mental health. A good social connections is important, and substance use should be managed properly. So we'll move to the next slide. So the occupational therapy's role in this lifestyle changes would be encourage a holistic approach in identifying and addressing the lifestyle factors which are affecting the immune health. We have to focus on personalized or client-centered plan to help help in clients' unique needs and preferences. We have to collaborate with other healthcare professionals. This would include the physicians, the dietitians, the nurse practitioners if they are involved, social workers, and psychiatrists if required. If a person requires rehabilitation, we have to work on his rehabilitation, which would include physical and mental rehabilitation. Next slide. Now, the occupational therapy action plan has to be holistic. We have to talk with the nutritionist, the dietitians, the psychiatrist, and we have to have an interdisciplinary collaboration to help in implementing this plan. Education, empowerment, and advocacy has to be done at the level of a small village, district, city, country, and internationally. So education and advocacy has to be done through written, oral form, or through social medias. Promoting healthy habits like healthy nutrition, good sleeping pattern, good exercise pattern. We have to promote why we should be away from the substance use, its importance within the community. And the last slide will give you information about my contact details and the website, which will focus on Care and Cure Clinic, which I had started since 2009, which helps in promoting health in physical and mental conditions. Anytime if you have any difficulties, you can just go through my mobile phone. This same mobile phone is available on WhatsApp and Telegram also. Along with that, I will always happy to respond to your communication through email, and you can go through different videos and links through my website for the more information and resources. Thank you.
Thank you very much, Dr. Mantri. That was a rich session there. Thank you for all the insights shared. Please, we're going to take questions based on this session.
Yes.
Let me see your electronic hand. Give you the floor for your question. Dr. About 3 hands that I see. And also, just to let you know that we have Sister Grace in the chat answering to questions and other worries. Or to our hearing, you can say something in the chat and there is somebody to give you a quick response. Anybody with a question for Dr. Mantri? Okay, Patrick's hand is up. Patrick, let's start with you, please.
Hello, doctor.
Yes, hello.
Yes,
how are you?
I'm good. I'm fine. How are you?
I am good.
Thank you very much. That was also very insightful, and thank you for that presentation. It was awesome. It was awesome.
Thank you so much.
I've been struggling with knowing about something which I don't know. Yeah, it might be a bit of a digress from what you talked about, but it's still in line because you talked about, sleep and rest, So what my question basically is getting to knowing the right type of bed or mattress to sleep on, because I think that also kind of affects quality of sleep, and the reason why I asked too is because of course it affects me personally. I've used some beds and I noticed that, sometimes I maybe wake up with some body ache or something. I try to change it again and then it gets better, but at the same time, maybe it now starts again or something. So I don't know, maybe there's some tips you want to share. Thank you.
Yeah. Yes, as you mentioned about the mattress should not be too soft and not too hard. Okay, so if it is too hard, it will give a pressure on your bones and muscles. You're going to sleep for at least 6 to 7 hours at night. So if you are having a hard mattress, it will directly give a pressure on your bony prominences, and that might affect your sleeping pattern. So the mattress should be not too soft and not too hard. Along with that, before going to sleep, you can go for a brisk walk prior to that, so that a kind of physical activity will help in creating some amount of changes in your body, which will further help in good sleep. You can have a glass of milk prior to sleep because that contains vitamin calcium in it, and which will help in initiating the sleep. Now, these practices we normally follow in our country, where we make use of a glass of milk prior to the going to sleep. So these kind of practices also help in a better sleep. Along with that, also work on your thinking process. Write down what all things you have done throughout the day on a piece of paper. That will help in projecting your thoughts outside. So once your mind has reduced stressors, or reduced thinking, or overthinking has been reduced, so that will help in improving the quality of sleep also. It is not always the mattress which improves the sleep, but it is the way we think also. The stressors, which I'm always saying, the stressors at times help in reducing your sleep. So you have to reduce the stressors to improve your sleep. Okay, so we have to remove our thoughts out. We have to project it out, either through talking with the people, through communicating, or at times through writing, which will further help in reducing the stressors. Reduced stressors will help in, again, initiating the sleep.
Thank you, Doctor.
Thank
Patrick,
you.
I think Okay.
Yes, it was good.
The presentation that we should avoid using our phones and laptops on bed. I think that's a, should I say, bad habit that most of us have.
Yeah.
I for one, I am on my phone to the last second before I drop it to sleep. But I heard you say that we have to turn these devices off like an hour before we sleep. So I
One
think
more thing I'd like to add is normally we have a habit of watching videos prior to sleep. We get a notification, different kind of notification. I myself have made a small change a few years back. I am switching off all my devices after 9 p.m. Okay, so automatically those who are already, those who know me personally, they never message me after 9 p.m. Okay, I encourage my patients also to send me a message and never to call after 9 p.m. I will respond all these messages the next day by around 7 a.m. So there's a total disconnect of around 10 hours, okay, every day. So if you reduce 10 hours out of the 24 hours or disconnect from your devices, okay, unless and until it is very much essential. So that will help our sleeping pattern and the quality of living.
thank you,
Okay,
Doctor.
we should avoid use of prime time shows, which normally starts in the evening by 9 p.m. on television. We should avoid those at that time, and we should watch those in the recorded versions or the next day whenever it is possible. Nowadays, this is possible. We can have recorded versions of all those things, or we can go back and see those videos back on that particular date. So we can make use of these changes. So if you just start switching off or at least putting your mobile phones on a silent mode after 9 p.m. or avoiding notifications in your mobile phone. Normally it's the Twitter, the Facebook, then WhatsApp, all these notifications which actually affects our sleep. And we have a tendency to respond to each and every question which is being asked in this communications. So we have to say no, we should learn to say no to these devices at times. So technology is essential, but at the same time, we should use it judiciously.
Thank you. We have Hassan Jean Paul's hand. Can we have your question, please? The floor is yours.
Okay, thank you very much. I first of all want to thank the organizer to initiate such a program. It's very, very interesting. I also thank the first speaker and now the second speaker. I have, some questions about what you have said concerning occupational therapy. If it happened that he has a lot of people to take care of, is he doing the collective therapy or individual therapy? This is the first question. Because occupational therapy engage the commitment of the therapist. Now, the second one, if somebody have post-traumatic stress disorder and is not interested in eating, and the person is seriously tired, how can we undergo with the therapy with such a person? This is the first question that I have before giving maybe the last one.
You have asked very perfect questions. Both the questions are I would like to give the answers. The first question which you mentioned is we have to have a personalized therapy sessions or client-centered approach towards the treatment, because occupational therapy works on client-centered approach. We have to assess the person's all the factors, physical factors, mental health problems, the work-related stressors, his working pattern, his or her working pattern, his or her behavior at home and in the society. Occupational therapies involve these assessment in personalized form. Occupational therapy cannot be given in a group, okay, altogether. Yes, group activities are encouraged, but before giving a group activity, we always need to have an assessment of the person or the client per se. Once we come to know about the person's capabilities, the difficulties faced, accordingly, we have to change the plan. Occupational therapist has to see to it that the plans has to be changed as per the client's needs. If the person shows improvement, then we have to change the plans or the programs. The next question which you told is about the post-traumatic stress disorder. Post-traumatic stress happens at every level. Even the practitioners have this kind of trauma. Many a times because of our working pattern or the excess work-related pressures that also at times affect the person's overall living or lifestyle. Post-traumatic conditions can also be seen in patients with different kind of previous history, like say, for example, previous history of fall or accidents or any other medical conditions. So those things also has to be taken into consideration. Occupational therapist has to plan this goal accordingly. I would be happy to know if you are satisfied with the answer, or do I need to?
Yeah. Yes, it's very interesting. Now, the last question, is there any rating scale of assessment for the each part of therapy?
Yes, yes. Occupational therapy has different assessment skills which are there. So these things are already available in our different websites. There are different societies which help in promoting this kind of scales, and these scales are being used in the clinical hospital setups for assessment purpose. And there are certain scales, and nowadays different apps are also available, which are being promoted by Occupational Therapy, World Federation of Occupational Therapy. This website is there, whereby these different scales for different conditions are available, and these scales are universal, followed in all the different countries, and they are recognized everywhere.
Thank you so much, Dr. Mantri, for those answers right there. We'll have a brief session at the end of our third presentation. Before the workshop rounds up, we'll have another session for question and answers. So if you have any question, Jean-Paul, could you please lower your hand so that we don't get distracted and think that you still have a question. So we have a 5-minute break, and we come, and after that we have a third and last presentation on the pathogens, modes of transmission, and food safety techniques. So when we come back after the break, we take on a third and last presentation for this workshop. Let's have a timer so we can, and like I said before the break, our third and last presentation for this workshop, the title is Pathogens, Modes of Transmission, and Food Safety Techniques. And this shall be presented for us by Mrs. Kwende Solita. If she's here, the floor is yours.
Reagan, thank you. Everyone, we are all welcome. My name is Solita, and I am a member of the Encourager Association, and by the grace of God, I happen to be a student in the nutrition, fitness and health at Lunex University. I'm so sorry about my voice. I'm a bit under the weather, but I will do my very best to be a bit loud so everyone can hear me. And I'm so thankful to Dr. Eman, to Dr. Mantri for their presentation. It's really good. It's kind of connected. And that's the reason why I would love to share a little bit of something that relates to everything they've said in terms of chronic diseases, in terms of maybe biological factors, in terms of psychological factors, and even social and environmental factors. And that's the reason why today we are looking at pathogens, mode of transmission, and preventive measures, as well as food safety principles we can use to keep bacterial sicknesses, disease at bay. So please, with the presentation being shared, I'll quickly move to the next slide, please. I think the next one, the table of contents. So from the table of content, we see pathogens, modes of transmission, food safety principles, infection control strategies. And the first point, we'll be looking at pathogens. So what are pathogens? I don't know if you have any idea about pathogens. You could drop a comment on the chat. But if we want to look back to what was being said in the I think the early 19th centuries, talking about the germ theory, it was quite known that Diseases come about as a result of decomposed fields in the environment, things that are in the environment that makes one become sick and so on. And if we look at pathogens, there are microorganisms that can cause diseases. And these pathogens, they live in our environment, sometimes even in the homes that we live in. Examples of pathogens we have here: bacteria. They grow rapidly on soil, water, air that we breathe, on our skin, and even in the foods that we eat. We also have viruses. And when you look at viruses, they actually cannot metabolize on their own. If you've heard about DNA or RNA, you see that our DNA carries our genetic material that is, let's say, responsible for protein synthesis to help us function daily and so on. So if a virus should access your DNA, it automatically gets to break down your immune system and maybe some organs, or let's say every organ in the body. We also have parasites. They feed on us. They depend on us. For example, what we eat goes to them and they grow inside of us. So the question is, what diseases do these pathogens cause? What are some of the diseases that pathogens can cause to us as humans? And I still say, if you have ideas of some of these things, you can just drop a comment on the chat. Prioritizing our health and wellness, in terms of this, we look at some of the diseases that are caused by these pathogens. We see, for example, bacteria. How do they come about? We talk about strep throat. Strep throat, I will call it in simple words, sore throat. For example, the utensils that we share with each other, it could be like a large family using spoons, forks, and for example, also, let's say someone drinks from a container, and let's say you share that container like directly with that person, you could get a bacterial infection. We are not saying that people that are close to you have a bacterial infection, but it's just for the purpose of safety. Also, we look at food poisoning. We have the spoilage bacteria that cause meals to get bad or to go bad at certain temperatures if the food are left outside, be it uncooked or maybe cooked. We also have tuberculosis that can come about maybe through sneezing, coughing from someone who has it. Or let's say you're singing in a ceremony, and let's say the mic that was used by the MC, you use that same mic to talk, and maybe the person has the bacterial infection for tuberculosis. And because you're not, let's say, vaccinated against tuberculosis, you tend to get that bacteria. And we see here viruses. We all know HIV and AIDS. We also have common cold, and an example of this, we have talked about it in this workshop already from the previous guest speaker. He mentioned the coronavirus. So we also have parasites. Parasites could be the large worms or the protozoa or the small worms. And if you look at this picture, you realize that there is something inside the mouth of the fish. If you look at it at a first glance, you think it's the tongue of the fish, but actually it's a parasite. And these are what parasites do to us. When they get into us, they benefit from us. You find yourself, you're hungry, and you eat, but you wonder, I'm just from eating, but why am I still hungry? Maybe you could have a bacterial infection, or maybe it could be for other symptoms, for other reasons. Yeah, but for the purpose of this presentation, we see parasites to have this role. Modes of transmission. How are these pathogenic bacteria or infections, how do they get into us? We've already mentioned quite some points. We talked about direct contact or indirect contact. And for direct contact, we can see the use of utensils, equipments, and even through sexual intercourse. We also have indirect contact, for example, the surfaces that we use daily or from time to time. Let's take an example. You're rushing to the office or you're rushing to work, and the moment you get in, let's say you're having a sandwich for breakfast, you just, like, because you want to settle in, you just drop the sandwich on the table, and you remove your gadgets from your bag and you're eating at the same time using your computer or whatever, the surface might have been cleaned by the cleaner, but for the purpose of safety, it's advisable that when you get into, let's say, your office, you could just make use of a disinfectant to still disinfect the table that you're going to use for the purpose of your job or maybe something else. That way it helps, because the moment you keep that sandwich on that table, you don't know if from the time when the cleaner cleaned, some bacteria or let's say pollens or dust have gotten on the table, and you could get a bacterial infection. And after eating, you find yourself having nausea, you're feeling some symptoms as though you want to vomit, or you could even have diarrhea and you start rushing to the toilet and so on. We also have the respiratory droplets, as we mentioned, cough, sneezes, maybe someone sitting close to you, the person coughs, and let's say you get the droplets and you also get the infection. We also have the common vehicle. We have food, water, as well as drugs. For food, we'll talk about food poisoning because it's very harmful and it could even claim lives. There are situations where food has been cooked and left outside for hours, and then you just rush in because you're so hungry. You dish out a cold food and you consume it. Before you know it, you're being rushed to the hospital. There are people who have found themselves in an unconscious situation. The roadside snacks that you buy, before you bought them, you don't know the preservative measures that were taken or the hygiene and so on. And the moment you eat it, it's already infected, and you too get the infection and you find yourself being rushed to the hospital. We talk about water. Water here, you can get these pathogens from, let's say, dirty water or water that is not well taken care of. We have water systems, let's say pipes that we use or the normal taps that we use. I take an example. There was a day that I think the head of the pipe that we use at home was opened, and I noticed some gravels, and I was like, where do these gravels come from? So it triggered me to know that we have to be careful. We just have to pay attention to what we eat, what we drink. And even the drugs that we consume, you could get a bacterial infection from these drugs. You could get parasites, you could get a virus. It depends on how you consume the drugs. For example, let's say you didn't wash your hands properly and you remove the tablet from its packet. Maybe the spoon that you're using to take the syrup, it's not clean and there is already like a bacteria on it, you get an infection. We also talk about vector-borne. These relates to carriers like mosquitoes that cause malaria. So these are the means through which we can get infected by pathogens, or let's say the pathogenic bacteria. Food safety and the effects of pathogens on food that we eat. We've already mentioned, for example, water pollution relating to dirty water. Let's take an example of a farmer, someone who is involved in high-intensity farming, or let's say you have a garden by the side of your home, and from time to time you have to do irrigation. I'll use the word watering. And let's say you find yourself in a community where there is no access to good drinking or clean water. You just use, let's say, a flowing stream that has, because the flowing stream has enough water, you carry enough water from there, but you don't know what is inside the stream. Is the stream being cleaned regularly? Do they take precautions? Are there people that are monitoring the sanitation of the stream and so on? You have zero idea. And unfortunately, let's say animals' feces are found in that water or in that stream. You get it and you use it to water your crops and so on. The infection already goes to the crops, and you get the infection the moment you harvest the crops and you eat the crops, or even take it to the market. Other people, the population, they get the infection. We talk about animal food products. Pathogens, they affect the animal food products that are infected. If you see an example of a salmonella, it's a bacterial infection that is found in the I think the intestinal gut of the animal. And the moment you consume an animal that is infected with this bacteria, you get the infection. And getting this infection, you begin to experience symptoms of diarrhea, of stomach spasm, and so on. That is the more reason why we should also pay attention to details. The meat that you're getting from the supermarket, you need to check the expiration date to ensure that it's not past its expiration date. And even when you buy the meat, you stock it in the fridge, it's advisable to consume it within the normal range of the expiration date that has been stated on the package. Because even though you keep it in the freezer, once the expiration date passes, I think you've noticed that when you keep meat for a number of days, the color changes. It changes from red to dark brown, or let's say a very dark color. That's already a sign for you to see that this meat is not good for me to consume. So, but if you want to think about the money that you spent in buying the meat, you go ahead and consume it, you're putting yourself at risk for an infection. And most especially, we talk about the lack of hygiene and unsafe food handling. And this is where fast foods or roadside snacks, they come into play. Because sometimes you're just buying something from or by the roadside and you're consuming it, you're feeling satiety, but you don't know how it was cooked, the conditions. We could have some cultural aspects where we make some very good drinks, cultural drinks at home, like fermentation takes place at home, the pasteurization takes place at home. But there is an issue because from the time when, like after the pasteurization to the serving of that drink, we don't know how it goes. And the moment you just take in things like that, you have no idea what it could cause or what it could lead to. That is why it is very important for us to wash our hands properly before cooking, after cooking, after using the toilet, even after maybe before we take a medication or even after we've taken our medications. It's very, very important for us to maintain hygiene of our environment, especially in the kitchen, because that is where the food comes from. So eating from a dirty plate is also an example of how pathogens can infect us in a negative way. For example, let's say you have a sponge that you've been using. Sometimes we are not conscious of how long we use the sponge that we wash our plates with. If you have a dishwasher, okay, it's fine, it's good. The dishwasher will help you to wash the plates even alongside with some hot water. But what if you don't have a dishwasher and you have to use the sponge every day? How long should you use the sponge? Should it be 1 week? Should it be 2 weeks? It's advisable to change the sponge that you use to wash your plates once every week. I know, yes, we talk about the economy, but let's think about our health. Because if sickness comes or if an infection comes, the money that you will spend treating yourself, it's more than the money that you will spend to buy a sponge for, let's say, every week. So let's pay attention to that. And even after we wash our plates with maybe cold water, you could just think of soaking them in some hot water or warm water, especially the utensils. Because if, let's say, you have a ceremony where you cannot afford to buy disposable plates or disposable spoons, disposable cups, you have to share the plates and the cups and the spoons, forks that you have at home. It's advisable that you take precaution after the ceremony by washing the plates and making use of some hot water to disinfect the plates. So that in case, because there are some bacteria that just using the cold water, they don't die. But if you can use the warm or hot water, it can kill the bacteria. So let's pay attention to details. And also I will start on the point on the overuse of pesticides, because especially for those who are farmers, if there is like an overdose of pesticides, let me use a simple word, let's say fertilizer that is being used on the crops that they grow, for example. If there's an overuse of the fertilizers and also the type of fertilizers that we use, we have to be very, very careful, because let's say you're using animal physics for fertilizer. Come on, animal physics, you can easily get salmonella or even E. coli, because these are bacterial infections that could get into the that the animal could have and could be present in the physics of that animal, and it gets even to the crops that you're cultivating, and it does not end with you. A large population will be affected. There are times when we have bought vegetables from the supermarket or maybe from the market, and we consume these vegetables, and without knowing, you find yourself, oh, I ate this vegetable, I ate this, and my stomach, I've not had rest. It's because maybe there was an overuse, the possibility, maybe there was an overuse of, let's say, fertilizer and so on. And also, when we talk about the parasites, they come too from the soil, especially for people who consume root products like cassava, potatoes, vegetables that are grown from the soil. You can easily get these parasites, especially the large worms. You could easily get them. So it's advisable that even the vegetable that you will harvest from your personal garden, so long as it's from the soil, you could try to wash it with some vinegar in order to get rid of any bacteria that could affect you. So we move to the next slide. And on the next slide, we look at food safety principles. And for food safety principles, first I want to point on the thermometer that we have by the side. If you look at this, you see meat, you see chicken, you see fish, you see various temperatures at which these different products should be cooked. And that's the reason why we talk about food safety. First, you have to wash your hands, personal hygiene. Wash your hands for 20 seconds. Pay attention to between your fingers, your fingernails. Before you cook, as we mentioned, it's very, very important. After eating, after you use the toilet, before you administer a medication, even after administering a medication, it's very, very important. Also, we should cook food to safe temperatures. And that's why you see, when food is undercooked, an undercooked meat, you could get an infection from an undercooked meat. And food should be refrigerated or kept in the freezer within 2 hours after cooking. And what this means is, after you've prepared your food, you've cooked your food, you've had your lunch or you've had your dinner, the food should not be left in the pot, standing on the gas plate or on the cooker. You should package the food maybe in a clean dish or container, and you can refrigerate it or you can put it in the freezer. If you have to eat that food, let's say the next day, you can refrigerate it. If you have to eat it like in 2-3 days, you can put it in the freezer, because it's very important. There's something called the spoilage bacteria, and that bacteria grows rapidly on food that is kept left on the cooker or left outside after 2 hours. So within 2 hours after cooking, it's important to keep your food in the refrigerator or in the freezer. The question is, I don't have a fridge. How do I go about this? Now, if you don't have a fridge, it's like advisable that you cook maybe smaller meals that you can consume immediately. Because if you cook much, then you should find ways to preserve the food, and you should preserve it in the right way to avoid infection. And also, even the meat, the fresh meats that we wrap, for example, we can wrap them in a good, maybe in a frozen bags that are meant for the freezer or for the refrigerator. Fish to be frozen, allocate date and time. So once you get, let's say, meat from the supermarket and you put it, let's say, in a bag that is ready to be placed in the freezer, you should allocate the date and the time. That way you can best monitor the expiration date. Also, for, let's say, you want to cook meat or fish, let's say tomorrow, and today the meat is in the freezer. What you can do is, if you cook that meat tomorrow, you can remove the meat or the fish from the freezer and you can store it in the refrigerator at the bottom shelf. you're keeping it in temperature to prevent bacteria from growing and to prevent infection. If you have to cook the meat immediately, let's say you forgot, you can try to thaw it in cold water or in the microwave using the defrost button on your microwave. But if you don't have a microwave, it's advisable that you can thaw it in cold water, and you can also thaw it in the refrigerator if you have one. This is generally safety principles to avoid the growth of bacteria that can affect our gut or can put us at risk for disease or sickness. Next slide, please. Okay, so we now see, we've already talked about thawing food in cold water, the microwave. Another thing is for hygiene, we have to like clean the spills or crumbs that gets into our refrigerator or our freezer. You cannot think of, or let's say you're being asked a question, how long ago did you clean your refrigerator or your freezer? You have to do this like once a week lightly and once every 1 to 2 months thoroughly. It's very important because if you open your freezer, sometimes the meat that you've placed in the freezer, it leaks out some blood and it becomes icy. So you have to like clean it out, clean the crumbs to avoid even the bacterial growth that will happen in the freezer or in the refrigerator. We already talked about the importance of keeping our kitchen surfaces clean, neat, and most especially allocate different chopping boards for different purposes. The chopping board that you use for vegetables should be used for vegetables, and the chopping board that you use for meat should be used for meat to avoid any form of cross contamination. Next slide, please. So when it comes to food storage, food safety is very much linked to how we preserve food, how we keep food in our fridges or refrigerator or the freezer. If we look at this diagram, we see this is like a refrigerator and let's say a freezer combined together. And we see here various positions, and we also see the pantry. We see different positions at which different products or food products are being kept. It's advisable that eggs should be kept. In fact, eggs, dairy products, milk should be kept at the top shelf of the refrigerator because it's considered as the coolest part of the refrigerator. For fruits and vegetables, we have to put them in separate drawers at the bottom of the refrigerator. And also for tomatoes, if you're going to like keep tomatoes that are supposed to be eaten within 1 to 2 days, you can keep them in the pantry. But if it's like going to be used over like for some time or in a couple of days, you can keep them in the refrigerator. For mayonnaise, peanut butter, you can keep them on the pantry, but once it's open, you should put them in the refrigerator. Next slide, please. Infection control strategies. Please, can we mute ourselves? Thank you. Infection control strategies. The next slide, please. So for the infection control strategies, we see ways in which we can keep the pathogens, the bacterial infections, the virus infection, the parasitic infections at bay. And here we have, for example, vaccinations. It's important for us to get vaccinated. Like in the period of the coronavirus, a lot of people were like, they didn't want to have the vaccine. They are not forcing you to have the vaccine because they want something to happen to you. It is for the purpose of safety. It is to prevent any sort of untimely death and so on. It is to prevent you as an individual or your family members or loved ones or people in your community from getting an infection. Because let's say you are in a community and you get an infection. It's possible that as you step out of your house, you will share that infection with 1 or 2 persons, depending on the type of virus or the type of infection that comes. Maybe it could be respiratory droplets. It could be through the coughing, the sneezing, or maybe the sharing of utensils and so on. So vaccination is very important. That's why you have the vaccination for tetanus. You have vaccinations even for the meningitis. You have also vaccinations for the coronavirus. We also have vaccinations for tuberculosis. Also, disinfectants are very, very important. Though I think they are gradually getting out of the supermarkets, or maybe people are no longer buying it because everything has become normal again, it's still important for us to get disinfectants. Because let's say you have a small disinfectant with you, the moment you walk into your office or maybe at the job site, you could just like use a bit to disinfect your hands and even the surface that you're going to use. Even when you wake up in the morning and you have to use the kitchen, you can also do some disinfection or disinfect the surfaces in your kitchen. This really helps a lot. So please, let's pay attention to vaccinations, disinfectants, and also this will help in safe food handling. Consumption of nutritious food, as we've talked about, is very, very important. Nutritious food that are balanced in diet, and it's also more appropriate and better to cook food at home than to depend on roadside meals. Antibiotics and antivirals. This comes to play in the case of HIV and AIDS. We have antiviral medications that should be taken. And I think based on research, it shows that people with HIV who consume their antiviral medications, they have higher chances of not getting into the latest stage of HIV, which is AIDS. So it's important for us to take our antiviral medications and also follow up with our doctors when it comes to antibiotics to prevent any form of bacterial infection or parasitic infection. Thank you all so much. And if you do have questions, please feel free to ask. Thank you.